I'm going to be reading because I actually got reports from other counties.
Great.
And so I had to write it down because my old brain won't remember it all.
That's okay. I appreciate that you do the legwork to get that done. All right, everybody. Hey, Reagan.
Hi.
Let me welcome everybody to the January 5th regional report out call for the Northwestern region of Kansas. We are here every week at 3:30, broadcasting live to this YouTube channel. Really want to encourage you, if you enjoy getting these, you can get this, a link to the recording of this call, which you can watch sped up if you want, and the dashboard attached to your email address. Just go to covid.ks.gov/report-outs. That's covid.ks.gov/report-outs with an S on the end there. Give us your email address and we can send this to you. And then if you have questions or comments, you can reach out to us at ksregionalreport@gmail.com, ksregionalreport@gmail.com. I'm John Rolfe. I'm your facilitator for these calls. And we're grateful to have everybody with us here in the new year. Let me kick it off by sharing with you the dashboard for this week. Hold on one second here. Sorry. Okay. So here's the dashboard that our friends at the Hospital Association so graciously put together for us. Didn't quite get 100% reporting, mainly because of the holiday, but this is, I think, the majority here. The staffing shortages is off this week also. There was a change with the reporting system on January 1st, where no staffing shortages was the default and it wasn't required anymore. So we're working with Hospital Association to make sure that gets filled out for us every week. So we have an idea of what's going on. That is still an issue for us. Looking at the 24, this is as of yesterday, the 24 adult staffed ICU beds in the region. There's 10 available. That's 42%. Also still, one of the better stories in the state as far as the arc of the caseloads go. We had a drop over Christmas week, which was true of everywhere in the state, but didn't get as significant a bump as we had in other parts of the state. So, that's a good sign for Northwest Kansas. And then the only concerning thing is the positivity rate of those tests taken between December 27th and January 2nd was 16.1%, which is the second highest positivity rate in the state. So there's something to be watching there. Going to the second page of the dashboard, typically a busy season for hospitals anyway, but you can see the ICU status here between COVID, non-COVID, and what's available. COVID, non-COVID, and what's available. And then the percent of the population in our Northwest territory here. So that is the dashboard for this week. And now let me kick it over to our friends. We'll start with public health and see if Paula can give us an update from that perspective. Paula, please, and if everybody introduce themselves and let everybody know where they're from, that'd be great too.
Hi, I'm Paula Bitter. I'm the Administrator and Health Officer in Russell County and for the Russell County Health Department. And Happy New Year's, everybody. Hopefully 2021 is going to be much better for all of us. I got some reports from some of our counties in the Northwest region, and so I just wanted to kind of reiterate what they were saying. First off, for the most of us, for the public health, and I hate to start off on a negative note, but most of us are frustrated. We're frustrated with the lack of the communication, especially with the vaccine process. We get pressure from our public because a lot of our, especially those that are 65 and over, are almost demanding that they get their vaccine now. And they don't understand why the allotment that we get is just for the healthcare workers and for long-term residents, and they just don't understand. So there needs to be, we're trying to do a lot of public education. That's one of our things. As far as vaccine, I know Logan County said they received 40 doses of the Moderna vaccine on the 28th. and they plan on giving the last of their doses on Thursday the 7th. Let's see, in Russell County here, we received 30 doses on the 21st, and we will give our remaining doses also on Thursday. Norton County, they received some, and they're actually going to be starting their second dose of their Pfizer vaccine this week. And then out at Sherman County, the Goodland Regional Medical Center and the Health Department in Sherman County have exhausted all their doses that they had originally allocated for the frontline healthcare workers and the long-term staff and the residents. And they still have about 20 healthcare workers still waiting for their first dose. As far as cases, we're following the state trend, over the holidays and everything. The region basically saw, a slight decrease in number of cases, and of course, our positivity rates dropped. For example, here in Russell, I keep track of that. In November, our positivity rate for the month was 27.5. For December, we ended up at 17.9. We went from averaging 85 cases a week in November to 28 in December. Logan County, they say they're averaging less than 5 cases a day now, which is a significant drop for them. Let's see, Sherman County, they currently have 550 cases, with 11 of those cases active and 9 deaths. And their numbers have steadily decreased, the past few weeks, along with their positivity rate. In a lot of our counties, the state has funded testing from outside labs. Here in Russell, it's True North. In Sherman County, they have Tour Health. That testing will continue to the end of January. And then after that, Sherman County plans on doing a drive-through facility. And Russell County, we're looking at actually start doing testing here. We hadn't been doing testing at our facility, but we've got the testing supplies. So after this outside people leave, then we're going to start doing testing here. A silver lining, Wallace County mentioned, that things were much better there. They closed 4 clusters, including a long-term care. And the reason why it didn't spread throughout their long-term care facility there is because the majority of the patients or residents there have private rooms, and the quick response from the staff. And she commends the staff for staying on top of things. They were fantastic to work with. And she said through that whole thing, they have a stronger partnership with all healthcare entities. They also plan on starting to vaccinate this week. And they said by the end of the week, they should have all their long-term care, assisted living, first responders, and healthcare workers that qualify and want to in their county to receive the vaccine. And that's about all I've got.
Thank you, Paula. On that vaccine distribution, I do think the state's working on a website that's going to help provide information. And I think the governor is going to provide more this week around the strategy, the rollout strategy, and how to go from here. But I'm hearing a consistent feedback on the frustration around the communication. And I think that goes up and down the channel as far as what's even coming from the drug companies to the state and all that.
Exactly.
I do know too, there's a lot of concern raised that, we were the worst in the country as far as the vaccine distribution, as you're hearing here, how well the counties are doing with it. It does appear to be a software issue where even some of the bigger hospital systems are having trouble getting it loaded right of who's been given the vaccine and all that. But Kansas was one of the few states in the country that pushed the vaccine out quickly to every county that they had. And so we do have it in all 105 counties. That's a great update, Paula. Thank you very much. Let me kick it over to Reagan to give us a perspective from the hospital systems.
Hi, Reagan Cusimano, Director of Governmental Affairs for the University of Kansas Health System, which includes Hayes Med, Great Bend, and Larned Pawnee Valley. And I'm going to talk about a couple things. One, just kind of around our numbers. To give a little perspective, last week I shared that around the 29th, we had 27 COVID cases in our HaysMed facility, with 21 of those active and 6 recovering. So a little bit of perspective, today we have 23 with a total of 16 that are active and 7 recovering. So we're not seeing kind of that uptick right now. We'll see what next week brings, but we did see a very small decline here over the last week. I did listen this morning to the Kansas City campus, KC metro area discussion, and I think one of the things that I wanted to share with this particular call was very interesting to me, and it came from Dr. David Wild, who is at the Kansas City campus here with the University of Kansas Health System. And one of the questions that was asked, and John, you can kind of direct me and steer me if I'm going in the wrong way, was like, what are we kind of seeing around COVID and death rate? And are we seeing any correlations? And one of the things that Dr. Wild brought up was we are seeing some correlations here in Kansas, and it's specific to age, people over the age of 85 and obesity. And in Kansas, we are a state that falls and clearly lags behind. We have a higher number of population who are over the age of 85, but we also have a very high obesity rate in the state of Kansas. And specifically, I think he said that we are 11th in the country percentile wise for obesity. And they really are starting to see a correlation between COVID illness, I guess I would say more documented correlation between obesity, illness, extent of the illness, and death rate. So that's something for kind of from a population health perspective that I think is interesting, and that the general population might be interested to know that that definitely is a correlation they are starting to see now.
Thank you, Reagan. Do you have a sense of where HaysMed's at from an ICU capacity standpoint?
I don't right now. I do know that they have a lot of their beds occupied. I think one of the things that we know is that we're seeing less flu patients right now. So those ICU beds aren't being taken up by any of our flu patients. It's mainly COVID. Overall, we're still continuing to see patients come in for regular illness and disease. And so it's always a little bit of a push for us when we're seeing, 23, 24, 27 patients who we normally wouldn't see during this time come through and occupy those spaces.
Yeah,
so I will check though, and next week I will ask them to give me a specific on ICU beds.
Yeah, thank you. And, a lot of good news on this call as far as getting some relief in Northwest Kansas from the disease. But, as people have more acute situations and need to be transferred to the hospitals with more tools and more specialists, we are starting to see some issues with that. And so you mentioned the KC call, the South Central Kansas call, which has Wichita, and the Northeast, which has Topeka. They are really close to the edge about being able to accept transfer patients, and oftentimes are not able to accept transfer patients. And Dr. Watson from Cheyenne Mountain Software has some real-time data to share with us, and we'll pitch it over to Dr. Watson.
Yeah, great, thanks. And I'll show you our current dashboard, which just updated between calls here, but we're seeing across the board capacity issues at the primary referral centers, and even the ones declined response, full but call back, said to call back. I mean, these are people who are very busy right now. I'll just tell you that. And if we go into the secondary receiving hospitals, you're going to see there is a little more capacity in some areas. I will say Northwest and Southwest Kansas actually seem to be faring better than other regions of the state right now. Not sure why that is, other than when you look at the number or the percentage of people that have tested positive in any of the counties, they seem to have some of the higher percentages that have tested positive. So maybe we're getting some play out of that. I think when we look specifically at the numbers themselves, across the board, we're seeing a decline in the number of people being moved out of Northwest Kansas. We will see that the median acuity is actually inched up. The number of percentage COVID suspected and the ones needing bed about the same. But I think what we're seeing by and large are fewer patients, but the ones that are needing to move are sicker generally. And so that's because of the problems we've got with capacity issues at the larger hospitals. It is presenting some backup. The wait times in Northwest Kansas have been pretty steady right now, and actually better than they were 2 or 3 weeks ago. We're seeing median times of about an hour, 20 minutes. But if you divide that out, it's an hour for the less acute and 2 hours for the more acute. So not the discrepancy we'd seen in the past, but still to be concerning. Again, if our regional resources were fuller, and if we were at capacity on a local level, the system would be back where we were mid-November. And literally, it just takes a couple of bad days to make it go that direction. So just really stressing again that this next week or two, depending on how the positive testing in other places play out, will probably determine what the state looks like for the rest of January.
Thank you. And just on our last call, North Central, which is pretty close here, Smith County was talking about, having 2 cardiac patients that were in a shorter amount of time that they were having a lot of difficulty finding placement for, and transportation for placement also. So something we'll keep an eye on and watch. Anything anybody would like to add after hearing this, Paula, Reagan, Dr. Watson?
I will say weather plays into it. It's enough to deal with this normally. Throw a few snowstorms or a good ice storm in there, and it's a different ball game trying to find people to move these patients.
Yeah, for sure. Well, we just want to encourage everybody to continue to lean in to getting tested, knowing where you're at if you're not feeling well, and the mitigation efforts that you can take. Certainly not a time to let up. And we'll be here every Tuesday at 3:30 for the Northwest region. I encourage you to sign up via email at covid.ks.gov/report-outs. And this week we've had bright spots from other regions, but we have 2 from this region this week, which I'm grateful to have. And both things that have come up on other calls that didn't come up on this one necessarily was the morale issues around the hospitals. It seems there's been a dip coming into the new year for folks. And so just a couple things that happened. With the help of donors, a local flower shop in Phillipsburg provided floral arrangements for all the residents of the Phillips County Retirement Center and Logan Manor at Thanksgiving and Christmas to brighten the holiday for the residents. And then in Gove County, an anonymous donor provided an evening meal of pizza for Gove County Hospital staff and the Gove County long-term care staff over the Christmas holiday. So just seeing people from the community stepping up to show love to the people that need the love right now. And so just great bright spots from both Phillipsburg and Gove County. Love those stories. So if you know of any bright spots from your region, please email us at ksregionalreport@gmail.com. And we'll be back here next week again for the report out. Thank you, Paula, Reagan, and Dr. Watson for your time. And we'll catch you next week. Thank you, everybody.
Thank you.